Hello everyone, I am Dr. Sarbjit Singh, Chief Ophthalmic Surgeon and Medical Director of Dr. Shamsher Singh Eye Hospital, Khanna in Punjab in India. White cataracts with high intra-capsular pressure because of liquified cortical matter almost always provides a challenge even to the most experienced of phaco surgeons. Many methods have been devised by surgeons to counter this challenge during phacoemulsification. One of such methods is to do a spiral capsulorhexis. In today's video, I shall be showing you exactly that. Hope it helps, and without further ado, let's get on with it. You can see that this is a very mature cataract. Doing a paracentesis here. And I'll stain the capsule with the trypan blue, then wash it out and fill the anterior chamber with viscoelastic. It's always a good idea to put a lot of viscoelastic on the cornea. This way you don't have to squirt a lot of fluid onto the cornea, especially if you are doing it under topical anesthesia. Use the cystotome, you make a small puncture and straight away turn it a little bit so that the capsule doesn't run away to the periphery. You start with a very small rhexis and slowly increase the diameter of the rhexis as you go around. You must always try to keep the flap flat so that the edge is visible. Here I just push the nucleus down to burp any cortical matter which would be under high pressure. So as we go around, we keep increasing the diameter of the rhexis and keep the flap flat. Here you see that the capsule has clumped up a little. Then it obscures your view of the edge of the rhexis. But in this case all went well, and since the cortex was all fluid, I didn't have to do a hydrodissection and use the cystotome itself to rotate the nucleus. If you complete the rhexis properly, and then the rest of the cataract surgery becomes routine. In this case I am doing a direct chop here. If your rhexis fails, then there's always a risk of getting more and more complications later on if you keep trying to do phacoemulsification. Initially it's wiser to actually convert to a different method like SICS or even ECCE. So if you like this video, please click on the like button, you subscribe, and also press on the bell button so you get notifications of new videos. Thank you very much for your patience. Bye.